Happy Friday to everyone. This is the John McEntyre Show live. I'm John McEntyre. Today is Friday. I almost said November. December the 6th. It's good. I'm not saying July. This year has flown by. So I'm doing good to not even have said July. But it is December the 6th, 2024. Hope everyone out there is having a good day so far. It's a beautiful Friday. A little chilly here, but still beautiful. And today is Medicare Friday. On Fridays we do Medicare, and we're going to get right into it because the clock is ticking. Tomorrow, Saturday the 7th, 11:59. If you have not enrolled into a new Medicare Advantage plan or Medicare Part D drug plan by 11:59 tomorrow night, you have missed the clock. You have missed the bus. Um, if you don't have if you don't have a plan, then you can't enroll into one. If you have one, you can't change, or you'll just be in the same one unless you cancel it or whatever. And Part D, that will be the window is closed for actually enrolling into a Part D drug plan. So make sure you put it on your calendar. You've had since October the 15th to do this, and it happens every year. I mean, plus this time of the year you're already busy as it is. But let's be honest, there's a lot of procrastinators out there. There's usually we're busy the entire time. Medicare agents, the good ones at least, um, people that understand, agents that understand Medicare, they are busy. This is like one of the busiest times of the year for them, if not the busiest. And that last day of AEP, the annual enrollment period, is the busiest day. And so if you want to talk to someone tomorrow, if you're going to procrastinate, wait till tomorrow, um, good luck to you because it's first come, first serve. That's the way it is. A lot of enrollments now are done by phone, and so you pretty much will have to sit on the phone. It's plenty of times I've heard people say, "Hey, I actually had to sit on the phone 4 hours waiting to talk to someone, and longer, or and I call back." Um, the only way you can go past the midnight, the actual midnight enrollment, the period at midnight, is if you're on the phone actually doing the enrollment. But other than that, sorry, because everything has to go in by then, has to be submitted to the actual carrier, and they stop accepting after that. Now, I will say this: this is annual enrollment period. This is not that they're. Well, let me put it like this: some people are just tired of the phones ringing, they're receiving calls, things in the mail, commercials on television. Every 5 minutes, there's a new Medicare commercial, and so everyone's saying, I cannot wait till this period over, so I won't have to receive any more calls, and I won't see any more commercials. That is true. You should stop receiving calls. Um, but the commercials, they're going to taper off. They're not going to go away because AEP is only one of the enrollment periods. There are other enrollment periods. Some people, they're on, they're on Medicaid, and they have special periods, like they may change addresses, something like that. Carrier may drop the plan, and they don't have anything. So those are special election periods, which happens throughout the year. So it does taper off. It will not go away, but it does taper off. If it doesn't pertain to you, ignore it. But if you know of someone, for instance, they may be on Medicaid, or they may be going into Medicare, so the commercials run also for that group. 10,000 new beneficiaries go into age into Medicare every single day. 10,000, closer to 11,000 from what I'm understanding. And so it's going to taper off, but it won't go away. But so let's just get used to that. But if you have a plan, which I'm going to make sure and stress that again, if you're already in a plan and you like it, don't do anything. It will renew January the 1st. Um, I talked to my father. We've looked at his plan. It actually improved some for him, and so he did take a call. Someone did call him, and he called me and said, "Hey, someone called, told me they need to look at my Medicare." I said, "Well, we've already taken care of that. Remember?" He said, "Yes, that's what I thought. I was just making sure. Just making sure." I said, "Yes, they're going to call and say, hey, we want to review it, things like that. But just tell them you've taken care of it. You're fine. Do not call me anymore, or just have a good day and move on." So, if to stress it, if you're already in a plan, Part D or Medicare Advantage, it will renew on January the 1st because it runs annually. And that is not to mistake this for Medigap supplement plans. Medigap supplement runs by anniversary. Whatever date you enrolled into it on a yearly basis, you can make decisions or choices. And if you don't do anything, then it's fine. You will just stay enrolled in it. As long as you're paying your premium, as long as you're paying the premium, you're good. All right. So those are just some of the reminders, But today, I actually wanted to get into. I had a question from someone we were working with, and they are a veteran. So first of all, I thank them for serving, and they had a concern. They've been on Medicare for 10 years, 10 plus years. Let me look at my notes here. Um, they're a veteran, and so they use their VA for most of their medical and prescription. Um, but they also have a Plan G, Medigap Plan G, for just in case purposes. And before I go forward, um, VA insurance is not considered creditable insurance um, to replace A and B. That rule, if you're with a company 20 or more employees and you have a group plan, you can stay in that and you won't incur any um, penalties for not enrolling, for late enrollment. VA does not fit that bill, so that's why he's in an actual Plan G. We talked, a couple of years ago. He looked into, and he's been in a Plan G and everything, and so he was fine because he has creditable insurance. So he avoided that penalty. He opted not to do a a drug plan, Plan D, mainly because VA's prescription drug plan is considered creditable by Medicare. In some cases, it may be considered creditable, but not everyone accepts it. And that's where this situation got a little, it didn't get sticky or whatever. It's just what he was concerned. He caught, we talked and I told him, I said, so he was wanting, it was something he wanted to do. I think it was a actual, let's see here in my notes, vaccine, getting a vaccine. VA didn't cover it. Well, the company said you could do it, but it will cost you $300 since he did not have a Plan D. And he was like, okay, I want to do this. I know that the clock is ticking. What should I do? I said, okay, well, since you have an enrollment, um, since we're in open enrollment, we'll do one of the drug D plans. Just so happened it was a drug D plan without a premium, and treat it like your G plan, your Medigap G plan, just in case for these types of situations. Um, you can choose which one to use, and so most of the time you would probably use the VA. In this particular situation, you can use your Plan D, your prescription drug Plan D. And so we got him enrolled into it. And his other concern was, will I incur these penalties because I haven't been in a prescription drug plan for 10 years? I've been in Medicare for 10 years. I've been using I've been using my VA. And I said no, because the drug D plan is considered creditable by Medicare. So he was good in that area. And when I say creditable, let me make sure and define what creditable is. Creditable is coverage that is considered to be just as good as Medicare, meaning that the coverage pays as well as Medicare, if not better. But it has to at least do. That's what all Medicare plans, every Medicare plan is at least just as good as Medicare. And then they, the Medicare Advantage plans, they offer some offer, uh, uh, you know, eye, eyeglasses, dentures, dental care, things like that. Those little extras pay for, gym memberships. So you've heard of silver sneakers, and then there's the other ones that depends on the plan is what it's called. Not all of them are silver sneakers, but what most people know it as silver sneakers. Pay for your gym membership, and then some other perks. And so that's what creditable means. Once we describe that, um, he understood. Okay, it's creditable, it's good. That's why it has the Plan G. That's creditable, and now he has the Plan D, um, just in case. It's just in case. So he won't incur any enrollment penalties. Now, with uh, with him enrolling in a Part D plan, the carrier one or two things happen. Well, number one, the carrier, they will send a letter saying they need him to attest to having creditable coverage for the months before enrolling into that Part D drug plan, because they want to make sure that they won't be doing anything outside of the guidelines of CMS for credibility, because make sure he wouldn't incur any penalties. And so he can he can wait for the letter, complete the letter, um, or he can fill in, he will fill in the dates of the letter. Let me get it right. He will fill in, he could complete the letter, he could wait for it, complete the letter from the or he can just call the carrier and do the verbal attestation, just to say that, yes, I've had creditable coverage all of these years that I've been on Medicare. And that works just as well because it's recorded in CMS. They can access it because that's what it is. It's record for CMS, and everyone should have the same record. Everyone should have the same record. So he wouldn't have to wait for the letter if he didn't want to. He can call the carrier, do it by voice, by overcall, or if he wanted to wait for the letter, complete it. You're going to put in some dates that the dates that you want on Medicare that you've had creditable, um, you know, in this particular case, prescription drug coverage the entire time, and which is easy. He's a veteran, so that's going to be easy. So those are some things to just be you have to be mindful of. Most people just think, well, I have this insurance. Well, you have to make sure that it is creditable, that it meets the standard. It's at least as good as Medicare, and if not, it's not creditable. And if you've been going a long period of time on that uh, um, on that plan or that coverage that wasn't creditable, you could be subject to penalties. And so I wanted to cover that today, for Medicare. I like to keep these kind of short and easy because it's a lot, and like we all know, Medicare can be extremely confusing. It's confusing is to anyone, much less to someone who's up in age, and sometimes um, there can be some things, maybe an illness that's coming on or something like that. Don't comprehend the entire situation of Medicare, and that's where we come into the picture. We talk to a lot of people. There's been plenty of times um, where I recommended a family member take them to the doctor because there's some memory type things going on, and now we're going to stack Medicare on top of it. It's confusing to a totally, fully 100% functioning mind, brain, and so we know what it could actually do for someone that's trying to handle all of this stuff themselves, and that's just not good because there are some very reputable companies out there, independent brokers that you could talk to and advisors that you could talk to for these particular situations. And so that's why we are here. And that's why I do Medicare Friday, because we receive so many um, questions and calls about it. I mean, I can basically almost could doing it this show on Medicare every day, and still every day, almost all day, because we're looking on social media and everything, and there's like thousands of questions every day about Medicare. Because, like I said, there's almost 11,000 people aging in every day. Because that is the boomer and senior market. There's over 100 some odd million of of the population that's on Medicare. And so, and it is constantly changing and trying to make improvements, trying to serve markets. Have to remember that they are not a blanket type coverage, especially with the Medicare Advantage, and even Medigap. They can be state specific. Medicare Advantage, it's zip code specific. It may be offered in this zip code, but the neighboring zip code, it may not be offered. Things like that. And so that's why it can be so confusing. And so that's why we use Fridays to answer these types of questions. And it looks like we may have to actually expand it. It's been suggested to me more than once to talk more and more about Medicare coverage, because that age group that has aged into Medicare, um, most of them, they're no longer working, fixed incomes, everything. So every dollar matters, and they have to. And healthcare is the number one concern for that age group. And lack of healthcare is the number one cause of bankruptcies, foreclosures, things like that in that age group. And so that's why I have to stress Medicare on Fridays. It gets its own day to take care of it. So I hope that the information that I gave was useful. And if it was, if you're watching by YouTube, subscribe, share it. If you're watching by Facebook Live, like it, share it, send in your questions. Fridays, I don't cover wallet wins, but if someone did send in a wallet win, I would definitely celebrate with them. Share those wallet wins, your questions, and everything. So if you haven't enrolled in a Medicare plan, uh, don't wait any longer. Don't wait any longer. Don't wait till tomorrow. Don't wait till tomorrow evening. I'll do it tomorrow evening. Don't wait. You may be on the phones. If you're doing it by phone forever, you may not be able to get in touch with an agent, and you probably definitely will not be able to talk to someone if you call the carrier directly, because they're swamped as it is. They're receiving calls for customer service, for sales, things like that, and so they may not be the best alternative to call. So the independent person like us, you can give us a call, touch base, or at least don't wait till tomorrow. Or if you do wait till tomorrow, be on the phones first thing in the morning, and you're going to have a wait period. So just be prepared for it. Just be prepared for it. So, like I said, I hope I offer some information. If I did, uh, like it, share it. I will be back Monday for another episode of John McEntyre Show Live. And until then, we'll talk.